10 o'clock by our time clock, so we'll do the Pledge of Allegiance to start the meeting. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And with that, we'll start the meeting. First item is approval of this agenda.
So moved.
I'll second.
Motion made and seconded to approve the agenda. Further discussion? Hearing none, all those in favor signify by saying aye. Aye. Those opposed, same sign. Motion carries. Next is public comment. We do have members of the public and staff online with us. Anybody got anything to say? Don't all talk at the same time. Okay. We're going to wait until the end of the meeting after we've talked about it. Purpose for this meeting is the emergency meeting regarding COVID update mask recommendations. So if Health and Human Services, John, you want to come up? Ladies, you can join them up here if you want. Yep. Okay. Morning, Tess. All right, John.
So, I got to say, I didn't think I'd be here this quickly after our conversation on Monday. As I noted at our meeting on Monday, we had just, we're moving into the orange category on CDC maps, which represents 50 cases out of 100,000. That then triggers the guidance for masking in indoor places for either vaccinated or unvaccinated individuals. Later that afternoon, or actually 11 o'clock in the morning, when the Minnesota situational updates, we got additional cases that I was pretty convinced would push us over into the red category, or 100 cases in 100,000. That in fact happened on Wednesday. So, I'm sorry, yesterday we saw that. I think there's about a day delay. So that's where we sit today. When I saw those cases, I felt like this has grown from, we better keep an eye on it, to we are now in the highest category of community transmission in just a couple of days. So I came to Tess and we worked out this agenda to be able to have a conversation with you guys. As I put out the information to you, my recommendation is the same recommendation I've had throughout the whole pandemic, which is to follow CDC and MDH guidance. Both CDC and MDH recommend that people, when they are in indoor spaces, that they mask up if you are in those high transmission or significant or substantial transmission categories, which we are. So that's my recommendation. It's pretty straightforward. I would imagine you have questions.
Got a few. With regard to the recommended mandate, we are not required by the state or by the feds to do this. This would be a county mandate.
Correct. It's, I guess the way I view it, well, first of all, no, there is no state or federal mandate. There is still a state of emergency with the federal government. Whether they would mandate something like that or not, I don't know. But the state no longer has a state of emergency, and therefore the governor doesn't have executive power to do something statewide. So this is, you guys are the public health authority for Houston County. This is what you, in this case, would need to wrestle with. I, as your director of public health and human services, I'm just advising.
Sure. So as far as the vaccination that we've received, is that still considered high efficacy or efficiency as far as protection?
Yes. Vaccines that people have received are considered effective, very effective. And There's indication, however, that there's some virus breakthrough, not a high percentage in anything that I've seen. And there's also indication that people who are vaccinated could somehow carry enough virus load to transmit it to somebody else.
On the Minnesota vaccine update, they list Houston County at 69.2% 16 and over vaccinated, correct?
As of 8/3, I picked this up yesterday. The situational update has kind of odd dates that they pick up vaccine, but the soonest I could get prior to this meeting was 8/3. That has a 16 and over percentage of 67.7%.
With regard to the new cases that are coming about and the cases that, everybody's reporting, I've heard different things. What's the percentage of unvaccinated people that are showing up with COVID versus the people that have been vaccinated but are now getting COVID? Do you know what the percentage breakdown is?
For Houston County.
Or in general?
I don't know any county or state specific numbers, and quite honestly, I would have to go and figure that out. I have heard, I think as some of you have, that a high percentage of those who are new COVID cases, as well as those who are significantly ill in the hospital, in ICU, a high percentage of those are people who are unvaccinated.
So the reports are that the unvaccinated are the majority of the cases that are being reported?
I think that's fair to say. But I don't have the specific numbers. I want me to do that.
Right. I've just heard both ways. I've heard that the unvaccinated are the large majority, and I've also been told that the vaccinated are the largest percentage of people showing up with this Delta variant as far as the COVID is concerned.
That I have not seen. I've seen quite the opposite, that growth in cases, growth in Delta variant, and people who are very ill, people who are in the hospital, in ICU, fatalities, a very high percentage of those folks are unvaccinated. But I don't have the exact numbers.
Has Minnesota Department of Health issued a statement as to is there a new average age? Is the age level going down as far as people that are contracting COVID, younger and younger?
I don't have that data point either. I have heard that as well. I've heard that there's evidence that there's a higher number of younger people and children. Children under 12 are one of the largest groups that are unvaccinated because they're not able to get vaccinated yet.
Have they said what's the effectiveness of wearing a mask? I mean, if you don't have a mask versus you do wear a mask, what's the percentage of how much does that improve your likelihood of not getting or spreading it?
I don't know a percentage on that as well, Commissioner. I guess prior to the vaccine, the mitigation efforts that we put in place were social distancing, masks, building closures, stay home, frequent hand washing, those kinds of things. That was our best defense at the time. Once we have a vaccine, that is far and away the best way to protect yourself or the people that you come in contact with from the coronavirus. That doesn't mean that the masks were worthless. It just means that the vaccine is far more effective. I think the fact that there is in any population a fair percentage of people who are unvaccinated and indication that people who are vaccinated can still contract the COVID virus, especially the Delta variant, that's what's led to the masking recommendations.
And after the state dropped their emergency declaration and the county dropped our emergency declaration, and we took away that having to wear masks and whatnot, everybody was pretty happy.
Yeah.
I've had emails and phone calls about people don't want to go back to the wearing a mask.
Or why?
Because it's, and the question is, well, how effective is it? I mean, what does it really mean? I mean, you look at flu cases and the number of flu cases way down. Maybe a contributing factor is the fact that we wore masks during that particular season, but the question still is, how effective are the masks versus the vaccine? I don't know as we can force everybody to get a vaccine, so.
I think the data on flu and things like that are probably directly related to masks and distancing, people working remotely, a variety of things that were mitigation efforts that were put in place for the pandemic. I think the thing that's important to note too, that, you know, to me, there's two things here. One is we from the beginning have followed MDH and CDC guidance. I'm relaying that guidance to you based on our current caseload numbers. That's the heart of this. The second part for me personally is there are people who are vulnerable in our community. In public health and human services in particular, we deal with a lot of people who are vulnerable. And some of those people, many of those people can't get vaccinated. If they're under 12, they can't get vaccinated. If they have certain medical conditions or have immune deficiencies or what have you, they can't get the vaccine. And throughout history, that's what vaccines are meant to be. They protect both us as well as those around us. And you hope that you can get enough people vaccinated that it chokes out the spread of these diseases.
So question with regard to wearing the masks. If we as a board institute a mask requirement for our employees, as an example, in this room, we would all be wearing masks then during this meeting. Or is there a 6 foot or more distance that you wouldn't have to have your mask on?
I need to look at the guidance specifically. Commissioner Johnson, you have.
Well,
I
it's
didn't get that printed.
the policy here says that if you're in the same room with a coworker, you have to wear your mask. Yeah.
Whole policy that.
I mean, this is what's before us today is to
Yeah.
approve
Yeah.
this policy that was sent out.
But,
I thought you were speaking of the.
I'm talking-
CDC guidance.
and using that policy, are we, just like this, are we talking about you'd have to, everybody in here to have one, whether we're 6 feet apart or not?
That's the way I read it.
I think that's the way it's written.
Jess, you're gonna have to come forward to talk.
I have a question, but our vulnerable population are 65 and over, correct? Is that what we consider? I know there's other people that are younger that are vulnerable too with their health conditions, but our vulnerable are 65 and over are what, 92% vaccinated?
Like,
94.8.
There you go. Okay. I mean, we here in Houston County have done a real good job of getting people vaccinated. I think a majority of us have done the right thing here in getting vaccinated. And we were promised, we were told if we got vaccinated, this is going to get us out of this pandemic and this back to normal life. And I fail to see where this is going to do that by going backwards and requiring a mask mandate for even for the vaccinated. And in our policy here, it says that it's for the employees only, not for the public that comes in. And I'm not a scientist, I'm not a doctor, but to me, that doesn't seem logical. What is this going to do as far as, what is this going to do to help slow the surge of the Delta variant if we're only going to require the employees to do it, but not the public? I mean, there might come a time here where the governor's going to have to reissue his emergency orders, and we will too. I think that's what we should wait and see, and if this happens, and monitor this. But I don't feel it's fair to our employees to mandate that they have to wear them, but not everybody else. It just doesn't seem fair to me. I dare say a majority of them are vaccinated, and we are no longer under emergency order in the county. I don't feel we have the authority to do this. So I just,
Okay.
Oh, go ahead.
From an employment perspective only, I'm not here to speak as regarding any expertise at all with regards to health issues. From purely an employment perspective, we do have the authority to issue a mask mandate for our employees. What is the benefit that I believe we get from that? From what I've heard from public health, as well as what we've all heard anecdotally or from the news medias, et cetera. Yes, people who have been vaccinated do get, it's just similar to the flu virus, and that you are still susceptible to the virus. It's just that you are likely not to have a severe case that would require hospitalization. So how does that help us? That information, how's that information informative as an employer? Well, as an employer, if we are looking at, we are thinly staffed, when we have potential for a virus that has high viral load, so where it's highly contagious. If we were to have, if we could minimize the number of employees that we have that are out on sick leave at any given point, that is very helpful to us. We are in contact with each other on a regular basis, much more frequently than we may be with an individual from the public, to where we would be, because it's more easily spread that way, we could be making each other sick more rapidly. It could literally go through our departments. Not to say that people would be hospitalized or anything like that, but they would be out for a couple of weeks. And that's from an employment perspective where John, I was meeting with John, that was my interest, was trying to keep a healthy workforce so that we have people continuing to be here. I think it's a different issue than whether or not we would require the public to wear a mask, members of the public coming in. But it certainly is, could be helpful in us maintaining that level of workforce that we need to provide the services that we do for that public.
I think the idea is not to protect the public from us, it's protect the employees from the public.
Or each other.
Or each other.
As John mentioned earlier, there could be asymptomatic vaccinated people that can be spreading the virus. Well, I don't know the percentage of our employees that are vaccinated, but it would certainly stand to reason that if it's a simple mitigation tactic is to mask up while we're working with each other, that would be we can require that in the workplace to keep each other safe. We make exceptions if someone had
well, there is exceptions in the,
an ADA case or if it's for safety. Such as you can't require a highly paid medical facility to have a sheriff's deputy who's out there by himself. All of a sudden he has to chase some perpetrator, stop and mess up. I mean, there are going to have to be exceptions, but it has to be a practical, livable policy.
I think the other thing I noticed understand it, the policy is not something that's standing. Other counties in the state have gone, they're going to require that their staff follow the CDC guidance as well as people who come into their buildings. So that's something that you can consider as well.
I'm for that. The CDC guidance says they recommend. It's not mandated. It's not required, and that's what the CDC guidelines say. Here, we're requiring it. We're mandating it.
Does this also mean that we're going back to working as many people from home as possible?
I can only speak to our department. I would say no at this point because with the emergency order that has ended, the waivers that we worked under during the majority of the pandemic are starting to unwind. And as a result, there are more people, county constituents coming to the courthouse to conduct business. So we need to have people here to do that. Our abilities to do a lot of those things remotely are diminished. And so my knee-jerk with the information I have today is no, I wouldn't be suggesting we send people home. I gotta say too, I sat here on Tuesday and I told you something, or I said Friday telling you something else. That's maddening, I would imagine, to you as commissioner. Believe me when I tell you that it's maddening to me as well. Throughout this entire experience, things change so quickly. And you kind of form what you believe is a fair and reasonable and strategic response to that. You go home and think, okay, that was hard work. We figured it out. And you come back to work the next day and everything changes. And so I appreciate the frustration that you guys have. I appreciate the frustration that staff have, the community. It seems like we're changing our tune all the time. And they're right, we are. And I think that's because the information that we get from who we look to as specialists is changing and evolving as well.
I do as well, John. I mean, I don't envy your position at all because it's ever changing, and Heather and Bethany too. I mean, all of you guys, it's got to be maddening. I don't know how you can do it. I don't know how you can stand it, but from what I'm just looking this from perspective of what CDC recommends, wearing a mask. I think that's something we should follow, and for our county employees as well, is to recommend it and not mandate it or require it. And I believe that's what our policy is right now. As we stand here today, is that it's on the door, it's recommended, correct?
On the doors.
We have a standing policy right now with regards to-
On the door I walked in today, it's recommended to mask up.
Policy, it's just a recommendation.
Right.
And I think it says it recommends that you're unvaccinated to so
You're right. It does. Yep.
because that's what our guidance was.
Yep.
until
Yep.
this week.
Well, they haven't changed, the CDC hasn't changed their guidance.
No, we've entered a different level of community transmission. That's what's changed.
So then is it going to be the recommendation that future board meetings go back to Zoom
I'm
to reduce the foot traffic in the courthouse? Is that,
We can't do that because of the
State.
state
I understand.
guideline. That's over with too.
right?
See, that's what I'm saying. We have to take our direction from the federal and state until they say, okay, we're going to go back to lockdowns or mask mandates or whatever. That's where we should follow suit, not the other way around, in my opinion.
Has the state of Minnesota switched to wearing, all state employees have to wear a mask?
I don't know. I know that there's been discussion of that. I've been trying to keep track of, what's, what other institutions are doing this. Certainly there are other counties that have adopted a requirement for their staff and people coming into buildings, their abilities to wear masks when indoors.
And I know all the clinics and the medical facilities, you have to wear a mask that never ended.
Yeah.
But you look at some of the bigger box stores, be it Target or Walmart or whatnot, their people are all wearing masks.
Mhm.
As far as that's concerned. I'm, go back to what you and Tess had said, we do have the authority to mandate this for the protection of our staff. As far as we can be more restrictive, we can't be less restrictive than what the state says.
Yes. Yeah.
And the-
Whether or not we want to do that.
And the unions are on board with that?
This isn't, we haven't talked with you, this all transpired very quickly.
So the unions haven't been consulted on this?
No, not through a meeting for process. They would have, certainly would have input. They are not the decision makers on it. They, this body was the decision maker on that. It's not a negotiated item. The, what the, I will say, provide one more point. If we have a recommendation rather than a mandate for employees, then my question becomes as employees, because this did come up in the past. You have some employees who may not feel that it's appropriate or needed to wear a mask, and others that do. And then where does what does the department head to with regards to trying to pull meetings together when some feel that is there a health issue and don't want to meet with other people who don't want to mask up? I don't have an answer for that other than to say it is policy that just simply means that I would recommendation leaves the door open for a lot of controversy between employees. And so that could create all employees would respect each other saying, well, I can't meet with you unless you're masked up, or it doesn't matter to me, we're all in this together. You don't wear a mask. That would be different, but I can see having differences of opinion between staff who need to work together.
So if it was mandated, how would that be different?
Then they have to all wear masks to be in the same room and all to feel protected. Whether that's an adequate protection or not, that's not for me to say, but at least there would be one policy with it, or one practice, I should say, that everybody follows.
So if they don't, then there's repercussions?
We have department heads that would work with folks and deal with it. It wasn't an issue in the past. I don't think there would be, it's just a clarification as to what is required in the workplace rather than just a general expectation.
Well, I'm sorry, dude.
Go ahead.
I'd like to think that our employees are respectful for each other. And if someone is wanting to wear a mask, they will respect that. And if they ask someone to wear a mask, I would certainly think they would be willing to do so as well. I have more faith in our employees and their respect for each other's coworkers to do the right thing in abiding by a request. Go ahead. Sorry.
Well, I was just going to say that, you know, we need to take care of our employees, the safety and of our employees. And we're looking at this. Perhaps some of the things could be adjusted in that policy. There are like the 6 foot thing, bring that in here, or if we have a shield or something. And the health and safety of our people is important, because if we lose staff working, we do not want to be the nucleus that spread something that possibly came in and went back up because of our I can't say negligence, but because of our practice. So we just need to look at maybe not being so restrictive on the policy, perhaps a 6 foot thing, or having a shield or something.
The shields are still up, correct?
Yep. In most cases, or all.
I just think with this virus, I have to ask John, I don't know what, because they don't. Transferability is so different from the. So I don't know.
Wisconsin State Fair is only taking credit cards and debit cards. They don't want to touch cash or exchange anything other than somebody swiping their card. So it is an issue. And I wish I had the answer, but I'm just thinking that we got to take care of our people too. It's an inconvenience.
In answer to Tessa's question, the Delta variant is significantly more contagious than just the regular strain.
Well, in each department, it has a say. Let's say, like Donna's down there, they don't want to wear masks. Can they say that? We ain't wearing masks? And then the next group over here says, well, we want to wear masks, recorder. Can they do that? Is there flexibility in there or is it? I have nothing wrong with wearing a mask, so I would think if you want to wear a mask, you should wear a mask. If you don't want to wear a mask, you shouldn't have to wear a mask.
If we pass this mandate, if we pass this policy, they don't have a choice. They have to wear a mask.
Yeah.
If we don't pass a policy, then it's a departmental, it's an individual choice
Yeah.
in that regard.
That's the
Wear a
way.
mask if you feel safer, don't wear a mask if you don't.
So, I guess, department by department, we always have different work standards, or different hours, different things. So it isn't that every department does exactly the same thing. So presumably we could have different approaches to that based on what we're doing. I personally think that that would be problematic in our department. People pay attention to what other departments do.
Yeah.
That would exacerbate what Commissioner Johnson said, that it feels just that there's, it's unfair or over restrictive to some and not others. And all that takes energy and time to talk people off the edge and all that. I don't know. Now we get to the point of speculating if the board doesn't pass some sort of policy on this, what would I as a department head do, or what would I as a department head do into the future? Because there's so many variables that are changing. And I guess with what I know right now, I don't know that I would say that we're going to mandate our health and human services staff to wear masks. What I will say is over the last couple of weeks, I've communicated with our staff to remind them and urge them to mask up, especially as they are interacting with the public, and especially if they're unvaccinated. To my knowledge, most have not. And I don't say that as any kind of slight to my staff. I, like everybody else, when the mandate to drop the masks happened, the first couple of days I felt really weird. But after that, I felt outstanding. And I have to tell you that the thought of going to masks and more restrictive is, it weighs very heavily on me.
And it does us as well. I
So
mean,
this isn't something that I think, wow, this sounds like fun. It's disheartening. It sucks the soul out of you to have to keep moving through some of these things. These are really, really hard messages to carry. And I think what further makes it difficult is the science is evolving, so is the virus. There wasn't a Delta virus or Delta variant of this when we started putting certain things into place. Now there is. And so those are different variables. And it makes it difficult to say, here's our stance. It's prudent. It makes sense. And we can stand by that. There's so many other variables that change. So I stand here and say, this is how it's going to be today. And 2 days from now, it all changes again. And I've got to say, well, I guess that doesn't work anymore. All I'm saying from my perspective as Director of Public Health and Human Services, and you guys being the Public Health Authority for Houston County, we have followed CDC and MDH guidance since the beginning of this. I bring that guidance to you as I have in the past. We had the benefit before of a state emergency and a governor's order. We don't now, but that doesn't in any way, in my mind, diminish the validity of that guidance. So,
and I agree with you. I think we should go with the guidance of CDC, and their guidance is recommended masking up of vaccinated and unvaccinated people. Recommended. That's the key word. Not required, not mandated.
Well, it's not mandated by the state yet either, so. I
It's
mean,
not.
And I think we need to look at this as from a mental health point of view. It's been debated about now too. It is, what is this doing for our mental health and our anxiety of people, kids, employees? I mean, it's something that I wish CDC and MDH would really strongly look at, and I'm sure they are. And it's a tough decision, but now I'm just talking from my own personal opinion on this, but I feel that it's just not a good thing for our mental health. It's just creating too much. We have enough of disagreement on other things. This is just, like exposing the more of it. And I'm all for the recommendation of wearing masks for the vaccinated and unvaccinated, and as a recommendation only, and not for a mandate.
There's mention about having departments decide amongst themselves, yes, we're gonna do it, or no, we're not. Well, we intermingle between departments. So, I mean, the one group that does not mask up and is over here with a group that does, is that gonna cause friction between the employees? The health and safety, again, is of our people is important, and of course our public too. But and I just want to make sure that everybody understands this is strictly for our facilities. It has nothing to do with the rest of the county, the bars, restaurants, and all that stuff. This is strictly our bailiwick that we're talking about. So
There's just a couple of other points. Whatever policy we determine, that is determined, or if at all, the draft requires review within 30 days so that it doesn't become just something that's standing out there ongoing without critical review. And the second thing I'd say about recommendations, and this is just my understanding, the CDC and the Minnesota Department of Health, it is my understanding, without some other kind of declaration, cannot mandate what employers do or don't do. It is not within their authority unless there is some kind of compromise with the legislature and the governor's office. So their recommendation can be read two ways. Exactly the way that we're talking about, it's just a voluntary practice amongst people in general, or it can be also read as this is, we're recommending to employers that this, and to businesses, that it is highly recommended that we go to a masking policy, because they don't have the authority to say you will. So just keeping that in mind, it's just a different way of looking at who has the authority and who has to do this. And so I do think you have the authority. However, for employees, if you like not to, that I understand that as well. But if you do whatever your policy is that comes out of here, I do recommend that it be reviewed at least every 30 days. And of course, depending upon what the Director of Public Health and Human Services information that is brought forth, it may need to be
To be in the red category, what's the numbers? 20 out of 100,000?
100 out of
100 out of 100.
how many cases we have in Houston County now? Approximately, right? I think I saw it in one of the emails or something.
active cases.
Cases that we know, yeah, current.
I don't know the active case count. I know that in the last approximately week, we've had about 30 new cases.
30.
We, that's more than we've had in the last 2 months. And so that, while those numbers are not as alarming as we saw at different times earlier in the pandemic, they are pretty significant, given the fact that we were pretty flat for last 2-3 months.
Those are reported testimonies.
Correct. Those are reported tested.
July, there was 16 cases.
And then
August, 21 cases. And that was, yeah, as of 8/1, yeah.
And I would say the majority of those July cases came toward the end of the month. So
Yeah.
I watch it every day. I did not bring that spreadsheet in today, but I think we've had 11 cases in June. Prior to the end of July, we were probably in single digits or 10 cases. And it ticked up pretty strongly in the last couple of weeks. Where we had 30 some cases.
These cases that you're talking about, is that cases that were hospitalized, cases that people were sick, or people that tested positive but just asymptomatic? Do we know how
I
to
would say
break down?
all of the above. It's positive cases.
Positive cases, so,
Right. So they tested positive for the.
Right. but we don't know how many were in the hospital, how many were sick at home, or how many were just
one was
There's
showing
one.
the signs.
There's one currently in hospital.
That's my understanding. Those are the numbers that sought some level of medical attention in order for it to be. It's just simply being tested or being some
So
level.
do we need a motion on this or? Can we vote? What do you
If
think?
we don't have a motion, nothing changes. If we have a motion, then we vote on it.
No motion stays like it is.
No motion, it stays as a recommendation. Following the CDC and the Minnesota Department of Health recommendations, which is where we're at right now.
And they're just recommendations, right?
One last note to your previous question, Commissioner, is I think throughout the pandemic, it's been widely reported that the numbers are likely an understatement of the actual. People have a varying response, so you may have a very mild case, not even know that you have it, and so you don't think to go get tested. Some people do get sick and don't want to be tested. There's a variety of those things happening, so we generally across the board looked at our numbers and said they're somewhat of an understatement. But the number that we were speaking of just a moment ago, those are positive test cases, that's all. We don't get variant information until much later. So any of the other pieces of, what that number represents or what portion of that number is hospitalized or different things like that, I don't have it.
So Tuesday we were orange, Tuesday afternoon we went to red. And immediately we have an emergency meeting of the county board to decide if we're gonna, it's kind of a knee jerk, boom, let's change. I like your thought as far as reviewing in 30 days to see. We got the
Well,
Houston County Fair coming up and what have you.
Yeah, and we don't have to wait 30 days. We can review this day by week,
Well, and I will continue to do that, and I'll continue.
I know you will. Yes.
I believe that 30-day was to be
Reviewed for
max.
this our
At
policy,
max,
this new policy. Yeah.
So, I think there's a lot of things changing daily. And as I said, there's a lot of people who are positive who don't know it. That term asymptomatic or whatever and can pass it. And like I say, we need to take care of our people, but also there's some concern within the workforce that are happy to get back to so-called normal. And so that's a catch-22.
As far as this week, Commissioner, it is pretty much of a whiplash kind of deal. What I will say is that the CDC levels, if you will, there isn't a higher level than their red level high community transmission. So I won't be coming to you this afternoon saying now we've gotten to a hurdle rating.
Right.
At least for right now, that is the highest level of community transmission that they identify. Now, within that, we may see things that give us indication that this is more pronounced and more people are getting sick in Houston County. We may see additional information that is more of the state and more information that comes to us from the state government or the federal government as a result of this. Those things may change, but as far as I know, this red level of community transmission is the highest level that they identify. That's why I felt it was important to come before you in an emergency meeting. Also, I'll note I have a planned vacation that I'm going to be out of the office next week. And I didn't feel it was right to kind of do some of the stuff and then disappear and leave it to my staff to try and deal with that. So part of it is my schedule, I will own that. But I think regardless of that, I would have, given the fact we moved into that red level, I felt that it was important for you as a board to at least consider this. Lastly, I'll say, again, I make recommendation to you. My job is to cast a vote. And I respect the votes that you take, and I respect the fact that you face the voters, of which our employees are voters. I get it. I've been around this for a long time. I don't take these kinds of things personal. I know we're all wrestling with it. And as I said, regardless of how you approach this, I will continue to evaluate this, and I'll continue to bring information to you. Our staff will continue to do the same thing. So just so that that's clear, this isn't, I don't take this kind of thing personally.
As was, I was reading in some of the emails, we had just a few counties here, a short time ago, 14, if I recall. Now it's up to 40 some counties that are affected or in this same category. It's looking like it's a statewide issue getting to be. Have we any information as to what our neighboring counties are doing thus far? Winona and Fillmore per se, have they made any decisions along the same line?
I think some of them will be making decisions in probably next week. Not all of them are in this red category. I know Olmsted County reached that, and they have passed a requirement for staff and people coming into buildings in Olmsted County to mask up following the CDC and NBA guidance. I
Dodge, Fillmore, and Winona are all red.
Those two of that are red at this time.
Film or Dodges, yes.
Yeah.
And
Didn't Winona and Fillmore get into the red? They were worse than we were when we had our meeting Tuesday.
Yeah.
So they must have been red.
I spoke with public health director from Fillmore, and she is going to be briefing her board on Tuesday. So I'm not sure what direction that will.
And it really doesn't matter.
I think what bears noting is that you're not the only county board that's wrestling with this, and some are choosing to establish policy for their staff and also adding to that. Not unlike some of the merchants that you mentioned before, Target, or something like that.
The other thing I look at is the practicality. I understand this, but then you've got the highway department and you got people going out dealing with contractors. They got to throw on a mask every time they get out of their truck. You got your people that are going out to see people and whatnot. They got to throw on a mask every time they get out of the car. The sheriff's office. You talked about the deputies, but they're in the courthouse. We got the courthouse itself, the trials and whatnot.
Sort of court system.
They run their own show.
But they came out this week and said we're going to follow county policy. So whatever, I think they recognize that counties are beginning to wrestle with this, and so the Chief Justice said the court system will abide by county policy. The only exception to that is in courtroom, the judge can make exception based on unique circumstances with people who are on trial or testifying or what have you.
I think we should do 30 days and revisit it.
Tend to agree. From the perspective that School's starting in 2 weeks. The fair is in 2 weeks.
We should have-
I'd like to see how things turn out before we do this. Myself, that's just me.
I agree with that. That'd be my opinion too.
Your thoughts, Dewey?
I guess, what signal are we sending to our employees? I think give our folks, I know it's not a popular thing. To be honest with you, I wasn't always up for wearing it. I brought along in case we did decide to do it today. But I don't know. That's a tough one. If we wait and see and things get worse, that isn't good either. But is it better to be proactive or reactive?
But I suppose if we did have a breakout, we could revisit it in 2 weeks, or I mean, if things went all boom, and then that, the governor says, well, we're mandating it now, well, then we can have another meeting and change our ways. I don't know if that's too late or not soon enough or what, but I mean.
The thing I look at in the building here is that we've already got the shields in place and whatnot to keep the separation from the general public.
I think they wear a mask if they want.
That's the policy right now,
That's what
recommended.
well, let's leave it then for 30 days and then we can revisit it.
I agree. We should just keep what we've been doing, recommend it. And as a county and as public health, we've always encouraged vaccination. Stress that it's important. We've done a real good job. We can keep doing better and encouraging vaccination. And I think we should focus on that. And I think the fact that we're requiring it for vaccinated people, how is this going to encourage the unvaccinated to get vaccinated? They're going to say, well, I got to wear it anyway. So what's the point? I mean, that's one of the arguments. So I just think we need to concentrate on encouraging vaccinations. And for those who feel the need to wear a mask and they respect them if they want to, or they request that you respect that as well. And let's just monitor this day by week.
30 days we'll have
So-
other county stuff going too.
I'm going a little bit out of sequence, but those other people that are online and listening to this, does anybody have a comment to make? You're the only Matt Clue, you're the only non-county employee, so I'm just checking with you.
Can I ask for a clarification?
Yep.
You guys have said that status quo is a support of the recommendation. So that, to my knowledge, that's not a board action that you recommend or you support the CDC's recommendations, stopping short of requiring it. Is that something that
Was a board action when we eliminated the emergency mandate and went with the recommendation that followed the CDC recommendations and the Minnesota Department of Health recommendations, right? Isn't that how we did that?
Yeah.
So there already has been a board action in that regard. So if we don't do anything now, it sticks to that same policy. Strongly recommend that people without vaccinations wear a mask, and people that have had vaccination can wear a mask if they so choose. Right?
Really, as long as it ain't mandated, you can't really make them, can you?
Well, we could if we
Yeah.
did that. So I'll call the question. Does anybody want to make a motion to,
Well, we don't have to.
I'm calling the question. I'm just asking if anybody wants to make a motion. If there is not a motion, then there's nothing going to happen.
No action.
But since that's a reason for the meeting, I thought I better call.
Yes.
Does anybody want to make that motion? Hearing none, then we'll move on to the closing public comment. Anybody got a public comment? Was that me or was that?
That was an echo.
Was it echo? Okay. No public comment. I would entertain a motion to adjourn.
So moved.
Second.
Motion made and seconded. Further discussion. Well, this isn't what you wanted to hear, but hearing none, all those in favor signify by saying aye. Aye. Those opposed, same sign. Okay, thank you.
Thank you, John.